Patient information is really the lifeblood of clinical care. One of the issues that we face is that Genesys was created from a merger of 4 hospitals. We have quite a disparate number of systems we deal with, so we have 127 different production systems that we run in our environment. We never had a system that the clinicians could go to find what they needed. They had to hunt and peck through many, many different systems in order to find the information about the patient. Once the patient left the hospital, does the chart go to the physician? Does it go to the medical records department? Does it go to accounting? Does it go to billing? And it was creating a workflow nightmare for us. We were excited when we found BlueWare and knew that they had the backing of IBM and could bring IBM in and help with this implementation.
Hospitals that use a Wellness Connection will have a document management system that will allow them to have all of their patient information within one repository. We have information in our system that comes in from their printed reports, their printouts. We can also scan in all of their handwritten nursing notes and physician notes, as well as bringing in x-rays, MRIs, as well as the sound of a heartbeat and lung sounds and loops, and they can access it through a browser.
There's some really exciting stories coming out from this project about improved patient care. The first one comes from Dr. Pang. He had a patient in the hospital, and this system allows him to look up the patient record from his office. And so he was able to create a prescription for that patient and get them on medicines immediately, whereas in our old environment, that patient probably would not have received that med until the next morning. So the patient got a 12-hour head start on getting those medicines, and that results in better health care for the patient, better results for the hospital because it decreases the length of stay of the patient. We saved a lot of time in terms of moving the chart throughout the facility, and we've saved a lot of money in terms of reducing the amount of times that the chart needed to be copied and moved and keeping multiple copies. We've also saved a lot of money in terms of clinicians. I have identified a lot of opportunities where tests were often run multiple times on patients, and we've been able to eliminate the redundancy of tests. Our days left unbilled reduced considerably and moved that cash immediately to our accounts receivable line.
With our electronic medical record, the Wellness Connection, we selected IBM's Content Manager and DB2 to write our application on.
The IBM products are reliable, they're robust, they're scalable. Those are all critical aspects when we start to build systems. We run 7/24/365. If the information about a patient is locked in one of our databases and our physician needs it, they don't need it when the system comes up, they need it today, right now. So the reliability and the scalability of the IBM hardware and software products are, in my mind, superior to other products that are out in the industry, and so we've standardized on those at Genesys. E-Business on Demand really means that our physicians can work with their patients anywhere, anyplace, anytime. It's the foundation technology that really runs this solution.
I believe that this on-demand strategy is really going to improve healthcare, and that's what it's really all about, is saving lives and giving the physicians access to the information that will help them save lives.
I'm excited about my decision to adopt BlueWare. I think it was probably one of the best decisions we've made and probably one of the most successful project implementations at Genesys. When I sit down with physicians, they're excited about it. This is the first time they've come to me with enthusiasm and said, you know what, that product helps me deliver better patient care.